That is, the first repertory was created. And after that, there was a split up. Kent, in his introduction to the repertory, talks about two methods. The artistic method no, he talks about, let me put it in a better way, acute illness, we have symptoms with the ranking I have told you, and this is the artistic method that Kent talked about, and this is the mechanical method. The mechanical method is repertorizing, keynote prescribing, and computer expert systems, while the artistic method is, in fact, if evolved to now to modern times, the classical homeopathy or the classical miasmatic constitutional homeopathy. Kent says that when you are a beginner in homeopathy, you should start with the mechanical method, that is, do repertorizing as we all know it, and then refer to materia medica. But as you get more experienced, he says that artistic method is better, because in artistic method you have in your mind, being experienced, all the psychological and physical profile, the full picture of each and every constitution, of phosphorus, of lycopodium, of medorinum, and so on. And if you have in your mind all these pictures, then it's easy taking the full history of the patient to be reminded of what is similar to him, and then prescribe without doing any kind of repertorizing. But he says that this is for an experienced doctor, and he also says that even if you do artistic prescribing, you have to found your diagnosis also to rubrics from the repertory or the materia medica. I will agree with him and disagree with him. I will agree that the chronic, you have to use the artistic method, but you have also to not to found your diagnosis in intuition or something like that. You have to be artistic to emphasize on the whole picture, and mostly to characteristics, but you have to found your diagnose, your prescription to rubrics. Not the rubrics of the repertory, to the rubrics that are included in materia medica. In acute mechanical, the first thing that characterizes classical miasmatic constitutional homeopathy is that if you have a patient with an acute illness coming to you, an acute illness that is at its peak, you have a common cold starting or at its peak and not when it goes away, then you have to prescribe for the acute condition because that's the similar for that moment condition. And you have to give an acute remedy, an acute constitutional remedy. This remedy will take care of the patient for some days, and when the acute condition goes away, you have to give him the chronic constitutional remedy that is similar to his chronic illness. Or else you will never treat and lessen his chronic predispositions. He will come to you again and again with exacerbations of the chronic illness, unless you prescribe again and again chronic constitutional remedies that are similar to his chronic miasmatic constitutional condition. So, in classical miasmatic constitutional homeopathy, we are focusing on the chronic illness, on his miasmatic characteristics, on his constitutional psychological characteristics, on his essence, on his full psychological picture, on his background, on his non-verbal data, on his general physical characteristics, and with this hierarchical ranking. And that's why my clinical experience shows me that we are very closer to his deeper state, and we have deeper and more permanent results. So, once again, it is very important to know what is an acute illness and what is a chronic illness, and that there are remedies, constitutional remedies, that are mostly acute and some others that are mostly chronic. The chronic constitutional remedies most of the times have also an acute, are similar also to acute illnesses. For example, pulsatilla is a chronic constitution, mostly similar to chronic illnesses. Yet, in many acute illnesses, pulsatilla is indicated as an acute constitutional remedy. But there are many, all the acute constitutional remedies do not correspond to chronic illness. For example, why so? Because they don't have full similarity. In the repertory and in the Materia Medicas, we have many entries. But, for example, Uaethia is a rare remedy, homeopathic remedy. Uaethia has some characteristic picture in certain acute conditions, or let's say berberis. Berberis has a certain characteristic acute constitutional picture in urine infections. But if you go to the psychological characteristics, not symptoms, of berberis, you will not find a distinct, specific, characteristic psychological picture at the state of clinical health as you have with phosphor, pulsatilla, arsenicum, and so on. So what makes berberis an acute constitutional remedy and not a chronic constitutional remedy is that he doesn't have characteristic acute pictures in many organic systems. He has only in one or two, and moreover, the criterion is that he doesn't have a characteristic psychological picture during the state of chronic illness, during the state of the clinical health. That's what doesn't make it a chronic constitutional remedy, and that's what makes it an acute constitutional remedy, used only in acute conditions. Because here we have full similarity. Similarity to the local conditions, similarity at the state of clinical health, during the state of clinical health, similarity to the psychological profile, to the miasmatic profile, full similarity. Here we have local similarity, less similarity. That's why here you have to choose among a large number of acute remedies, since acute remedies are much more, and here we have to choose among a smaller number of remedies, because you have full similarity. That's why chronic constitutional remedies are about 50 or so, a bit more, and from them only 20 to 30 are the very polycrest ones, the one found in abundance. While in acute constitutional remedies you have to choose from about 200, 300 number of acute constitutional remedies, and from these 200, 300, only about 60 to 70 to 80 are the ones found in abundance, the polycrests. And in these 70 to 80, you can also find remedies that are not only acute, but some of them are chronic also. This is something that can be revealed if one goes to my book, Homeopathic Materia Medica of Acute Illnesses. I took the repertory of Kent, did a repertorizing in all usual acute conditions of everyday clinical practice from all systems, acute conditions of the respiratory system, acute conditions of the urinary tract, acute conditions like headache, vertigo, and so on, following the repertory line. And I found out that only 87 remedies had a characteristic acute clinical picture, and only those 87 should be called as true acute constitutional remedies, or some more. That's why I say 200, 300 the most. While in my volumes of classical miasmatic constitutional materia medica, you can find only about 40 to 50 chronic constitutional remedies described. Those that are have full similarity with chronic natural illnesses. So, this is the main difference between classical miasmatic constitutional homeopathy, who focuses on the chronic illnesses and with a hierarchical ranking, while in repertorizing, keynote, prescribing, and computer expert systems, we mostly deal with acute illnesses or with some characteristics, general physical characteristics of the patient, or with some psychological characteristics. But if you base your diagnosis on repertory, because the repertory refers mostly to acute conditions and to symptoms, not to characteristics, then you end up with partial similarity and you don't go deep enough. Furthermore, I may remind you that we said that not all proving pictures are true homeopathic, chronic or acute constitutional remedies. So, from the 5,000 proposed remedies, only about 300 are the true existing homeopathic remedies. So, that are similar to naturally existing acute or chronic illnesses. So you have a great possibility to prescribe remedies that are not true remedies, that are proving pictures and so have partial similarity. That is why we have to say that this is a book about proving pictures, and this is about a book about true homeopathic remedies. This is a true materia medica. So, in classical miasmatic constitutional homeopathy, one first characteristic that makes it different from repertorizing, keynote prescribing, and computer expert systems is that, first of all, we'll deal with chronic illnesses and prescribe chronic constitutional remedies. Second, we don't use the repertory. We use it only for acute illnesses. We don't need it in chronic prescribing, which is the 90% of our job. Absence of repertory. Repertory has many disadvantages. First of all, it includes remedies that are not remedies. They are not homeopathic remedies, they are partial proving pictures. Then it has a mechanical way of being a dictionary. It is a mechanical way of listing things. For example, you have the rubric fear of insanity. And you have many remedies. You have fear of insanity, Mancinella. You have Argentum nitricum. You have Pulsatilla. You have Calcarea. You have alumina. These are psoric. This is psoric psychotic. This is another thing. You have fear of insanity because you have many fixed ideas. So, apart from the difference of these remedies miasmatically, we have difference in the why does he have a fear of insanity. So, fear of insanity may give you a tip of what remedies you should look for. Not all remedies that have fear of insanity are included there, and not all of them are ranked in the correct way. Yet, you don't have any real information about why and under what conditions and why miasmatically this remedy has a fear of insanity. And you get confused. So, we are focusing on chronic illness, so we are basing on characteristics and not on symptoms. We don't use repertory, so we are not confused with remedies that are not true remedies, and with all the disadvantages of repertory. Then we have another innovation. We are based, being a classical method of homeopathy, on the homeopathic laws, strictly. That is, we give only one remedy, the similimum, the one that has full similarity with the whole, law of the whole, psychologically and physically. We prescribe for the patient and not for the disease. We individualize, and we wait and see. That is what makes a certain homeopathic method classical. If you follow the homeopathic laws, the law of the one remedy, the similimum, the law of individualization, the law of the whole, the law of hierarchy. That is, you take in consideration first the miasmatic characteristics, then the constitutional, the psychological characteristics, and then you go to the physical and to the symptoms. Homeopathic laws, laws of hierarchy, similimum, and so on. Then we have another innovation. The innovation is that we discriminate between pathological phases. Pathological phases. We have pathology, phase A, B, C, and D. What does that mean? When you do proving, if you give great dosages, high dosages of crude element, and very shortly repeated, then you go straight to pathology D. It's what happens in poisoning. If you've got a severe poisoning, you come very, you go in a short time, in minutes, you go to the great pathology of phase D. You've got vomiting, you've got diarrhea, you've got loss of consciousness, and the mental functions are very severely disordered. So when you watch severe poisoning, you don't have information from these early phases. You've got information from C and D phase, and then comes death. But that's why in the provings we give low dosages, repeated not very often, in order to have a gradual poisoning of the person. When you have a gradual poisoning, you can observe phase A, which is the early phase of illness, when you have functional disorders. Functional disorders. While here we've got pathology. Why is this important to homeopathic prescribing? It is very important because from the provings, if you have observed phase A functional disorders, and from the clinical practice, then you have characteristics. You don't have symptoms. You've got characteristics at the state of clinical health, at the state of chronic illness. While here you've got symptoms. You've got symptoms. At phase B, C, D, you've got symptoms. Let me give you an example in order to illustrate. Let's take phosphor. Phosphor at phase A, B, C, and D. We usually know the phase B for phosphor. This is what is described in the Materia Medicas and in the repertory. You've got, it's the phase of the neurovegetative disorders, the phase of the panic attacks. You've got a person that has the panic attacks of phosphor. Oh, my heart, I have a pain here. What is it, doctor? I'm in pain. Is it my heart? This is the panic attack phase, phase B. Here you have symptoms described. Here you've got acute illness. While here you have characteristics. At phase A you have characteristics. Here you've got symptoms. How do you recognize a phosphor at phase A? There comes to you a patient for preventive medicine. He is not ill, yet he says to you, I have heard that homeopathy can act preventively, so I don't have any problem, but I come to you, can you give me a homeopathic remedy, or don't I have a certain picture? He doesn't have a picture of acute illness. He doesn't have a picture of disease. He's got a picture of chronic illness, a picture of characteristics. And how do you recognize him? A phosphor at phase A does not have panic attacks, does not have fear about his health, yet he has a special concern about his health. He tries to eat healthy food. He tries to exercise. He avoids sleeping on the left side, because he has heard from others or from doctors that if you sleep on your left side, you press the heart and you disorder its function. So you see, we don't have fear symptoms, but we have a special concern about health. And we find other characteristics, that he is altruistic, that he is very social, and so on. So we have a picture here. A picture that was revealed from the proving, if we did it correctly and have observed pathology phase A, and the picture that was revealed from clinical practice when we have examined many phosphorus patients and found out that in their everyday life, when they are well, when they are not ill, when they are clinically healthy, they have these physical and psychological characteristics. When phosphorus is suffering from panic attacks for months and years, then he goes to phase C. At phase C, we've got sadness. We don't have fears. His fear about health is not so great at phase C. He is at the phase of sadness. He becomes less social, more sad, less happy, less altruistic. He is introverted, while in phase B and A he is extroverted. And things change. And when we come to phase D, we've got severe pathological findings, and he doesn't have a characteristic profile, psychological profile, because at phase D, all patients, no matter what miasmatic and constitutional influence affects them, we don't have so much distinct pictures that are apart, that can be discriminated among each other, with each other. Here we've got a very characteristic picture. Here also we have a characteristic symptoms. Things get less characteristic here and much more less characteristic here. So if we focus, as we do in classical miasmatic constitutional homeopathy, to phase A, to characteristics, we are closer to truth. And it's easier to discriminate among less number of characteristics than a great number of symptoms and pathological findings. So, in miasmatic constitutional homeopathy, we've got the discrimination of phases A, B, C, and D, and we focus mostly on A and partly on B. So when the patient comes to us, we ask him about how he behaves, what emotions he has, and how he thinks when he is clinically healthy at chronic illness. We are interested in these two phases of pathology. Another innovation is the discrimination between primary and secondary behavior. Primary and secondary. Let me tell you something more. In repertory, we have mostly this data from these phases. Only rarely we have from this phase. And we don't have a discrimination about the information if the symptom included in the repertory comes from this phase, from this, or from this. This creates a confusion. For example, you may find a certain constitution, let's say phosphorus, pulsatilla, calcarea, and so on, And you may find diarrhea, grade 3, and constipation, grade 3. And you say to yourself, is it a remedy that is mostly constipated or diarrheic? Which is it? The confusion goes away if you understand that he's got, at phase A or B, he's got constipation, he's a constipated patient, but at phase C or D, he's a diarrheic patient. Or you may find a patient that at phase A may be cold, but at this phase he is hot. Or you may find a patient that at this phase he is calm, but he is very restless, but at the more severe state he is not restless, he is very calm physically. We have so many confused symptoms, phenomenically, superficially adverse symptoms, symptoms that are contrary, seem to be contrary, while they are not, because each one corresponds to a different pathology phase. Only if you have the pathology phases of a certain constitution distinct in your mind, separated one from another, then you are not confused. And if you focus on phase A and B, then things are more clear. Primary and secondary behavior. Especially in syphilitic constitutions, we may have a primary behavior which is the true behavior of the person, but in reality, this primary behavior is conceived and the person projects another behavior, a secondary behavior. He creates an image to the others, which is different from his real behavior, from his intentions. For example, you may have a lachesis patient who is syphilitic, and you may see what is the primary behavior of a lachesis patient. The primary behavior is that we have a person, let me illustrate it better. The primary behavior of a lachesis is that she is syphilitic, is that she is a dominating person. She wants to rule over others, over her children, over her husband, over her colleagues. She may also be cruel and many other syphilitic characteristics. Yet, if she has the chance, if she is a Gestapo member, this primary behavior will be the same as her secondary behavior. She doesn't have a secondary behavior. She is cruel inside and dominating inside. She is cruel and dominating outside to other people. Yet, most of the times, this is not accepted in our society. So she tends to adopt a secondary behavior that is the opposite of what she is. That is, she plays the role of the sensitive person the mother who loves her children and her husband pathologically, who is very sensitive, who cries a lot, who is not dominating but worries about her children, who is a very moral and decent Christian, and so on. From the one side we have a Gestapo behavior, a cruel behavior. The other side we have a very sensitive and not dominating person. This is an image. She pretends to be so while she is so. This is a secondary behavior, a false behavior, and not a true behavior. And when you do repertorizing and you don't know the real image, the real picture, the real essence of an idiosyncrasy, then you may prescribe pulsatilla. Because this Lachesis person pretends to be a pulsatilla person, a very gentle, a very crying, a very sensitive, and a very romantic person. But she adopts this behavior in order to rule her children and her husband. Because she says, oh, you can do anything you like, my child, but if you marry that woman that I don't like, you will make me sick, you will hurt your loving mother. That is a true syphilitic behavior. Or she may say to her husband, you are free to do anything you like, I'm not jealous at all. But then she starts looking at his mobile phone to see where did he call, why was he late. And then when the husband says, oh, you are so jealous, I'm not jealous, I am so in love with you, I don't want to lose you. If you don't discriminate between primary and secondary behavior, you have a great chance to prescribe wrong. Miasmatic knowledge helps us discriminate between primary and secondary behavior. Not only syphilitic individuals, but also psoric and psychotic individuals may pretend to be different from what they really are. So, it is a great innovation about classical miasmatic homeopathy and very helpful in everyday clinical practice. In our classical miasmatic materia medica, we don't only describe the thinking, the emotions, and the primary behavior of a certain constitution, we also describe all kinds of secondary behaviors that certain constitution tends to adopt in everyday life. Then we have non-verbal information. In classical miasmatic constitutional homeopathy, we adopt non-verbal information or data that is very helpful as indicative of